Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Twice yearly, Lenacapavir for HIV prevention in men and gender-diverse persons. Background. Twice yearly subcutaneous Lenacapavir has been shown to be efficacious for prevention of human immunodeficiency virus, HIV, infection in cisgender women. The efficacy of Lenacapavir for pre-exposure prophylaxis, PrEP, in cisgender men, transgender women, transgender men, and gender non-binary persons is unclear. The HIV incidence with twice-yearly Lenacapavir was significantly lower than the background incidence and the incidence with F/TDF. Left atrial appendage closure after ablation for atrial fibrillation. Background. Oral anticoagulation is recommended after ablation for atrial fibrillation among patients at high risk for stroke. Left atrial appendage closure is a mechanical alternative to anticoagulation, but data regarding its use after atrial fibrillation ablation are lacking. Among patients who underwent catheter-based atrial fibrillation ablation, left atrial appendage closure was associated with a lower risk of non-procedure-related major or clinically relevant non-major bleeding than oral anticoagulation and was non-inferior to oral anticoagulation with respect to a composite of death from any cause, stroke, or systemic embolism at 36 months. Alteplase for posterior circulation ischemic stroke at 4.5 to 24 hours. Background. The effects and risks of the use of intravenous thrombolysis between 4.5 and 24 hours after the onset of a posterior circulation ischemic stroke are not well studied. Conclusions. Among Chinese patients with mainly mild posterior circulation stroke who did not receive thrombectomy, Alteplase administered 4.5 to 24 hours after stroke onset resulted in a higher frequency of functional independence at 90 days than standard medical care. The genetic architecture of congenital diarrhea and enteropathy. Background. Next-generation sequencing has enabled precision therapeutic approaches that have improved the lives of children with rare diseases. Congenital diarrhea and enteropathies, CODES, are associated with high morbidity and mortality. Although treatment of these disorders is largely supportive, emerging targeted therapies based on genetic diagnoses include specific diets, pharmacologic treatments, and surgical interventions. See inclusions. We have characterized the broad genetic architecture of COD disorders in a large case series of patients and identified 3 novel genes associated with CODES. Next, we will be discussing articles from Journal of American Medical Association. Cardiac arrest during long-distance running races. Question. What is the contemporary incidence of cardiac arrest and death among marathon and half-marathon runners in the U.S.? Findings. In this case series and cohort study from the Race-Associated Cardiac Event Registry, the incidence of cardiac arrest during marathons and half-marathons has remained relatively stable since 2010, compared with 2000 to 2009. The risk of dying from cardiac arrest during long-distance running races has decreased by approximately 50% compared with 2000 to 2009, meaning effective emergency action planning during marathons and half-marathons, inclusive of immediate access to defibrillation, has likely led to significant improvements in cardiac arrest outcomes, equivalent to settings with publicly accessible automated external defibrillators. Next, we will be discussing articles from Annals of Internal Medicine. The effect of 4 to 3 intermittent fasting on weight loss at 12 months, a randomized clinical trial. Background. Long-term, greater than or equal to 12 months, Randomized trials evaluating the efficacy of intermittent fasting, IMF, as a dietary weight loss strategy are limited. Furthermore, no studies have compared IMF versus daily caloric restriction, DCR, when both interventions are provided in the context of a guidelines-based behavioral weight loss program. Conclusion. Compared with DCR, 4 to 3 IMF resulted in modestly greater weight loss among adults with overweight or obesity enrolled in a 12-month, high-intensity, comprehensive behavioral weight loss program. Next, we will be discussing articles from British Medical Journal Effects of Intensive Blood Pressure Treatment on Orthostatic Hypertension Objective 2. Determine the effects of intensive blood pressure treatment on orthostatic hypertension. Conclusions. In this pooled cohort of adults with elevated blood pressure or hypertension, orthostatic hypertension was common and more intensive blood pressure treatment modestly reduced the occurrence of orthostatic hypertension. These findings suggest that approaches generally used for seated hypertension may also prevent hypertension on standing. Next, we will be discussing articles from British Medical Journal Effects of Intensive Blood Pressure Treatment on Orthostatic Hypertension Objective 2. Determine the effects of intensive blood pressure treatment on orthostatic hypertension. Conclusions. In this pooled cohort of adults with elevated blood pressure or hypertension, orthostatic hypertension was common and more intensive blood pressure treatment modestly reduced the occurrence of orthostatic hypertension. These findings suggest that approaches generally used for seated hypertension may also prevent hypertension on standing. Next, we will be discussing articles from Lancet. Pharmacokinetics and Safety of Once-Yearly Lenacapavir, a Phase 1, open-label study. Background. Long-acting antiretrovirals can address barriers to HIV pre-exposure prophylaxis, PrEP, such as stigma and adherence. In 2 Phase 3 trials, twice-yearly subcutaneous lenacapavir was safe and highly efficacious for PrEP in diverse populations. Furthering long-acting PrEP efforts, this study assessed the pharmacokinetics and safety of 2 once-yearly intramuscular lenacapavir formulations. Interpretation. Following administration of once-yearly intramuscular lenacapavir, median plasma concentrations exceeded those associated with efficacy in Phase 3 studies of twice-yearly subcutaneous lenacapavir for PrEP for at least 56 weeks. Both formulations were safe and well-tolerated. These data show the potential for biomedical HIV prevention with a once-yearly dosing interval. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from Journal of Clinical Oncology. Efficacy and Safety of Denileukin Diftitox-Cxdl, an improved purity formulation of Denileukin Diftitox, in patients with relapsed or refractory cutaneous T-cell lymphoma. Purpose. Denileukin Diftitox, DD-Cxdl, is a fusion protein comprising diphtheria toxin fragments A and B and human interleukin 2. This Phase 3, multicenter, open-label, single-arm registrational trial evaluated the efficacy and safety of DD-Cxdl in patients with relapsed/refractory, RR, cutaneous T-cell lymphoma, CTCL. Conclusion. Efficacy and safety results show that DD-Cxdl would potentially fulfill a serious, unmet medical need for patients with RR CTCL. Here are the articles from Journal of Hepatology Association of Metabolic Signatures of Air Pollution with MOSLD, Observational and Mendelian Randomization Study. Metabolic signatures of air pollutants were identified by 251 metabolites. Air pollutants, PM2.5, PM10, NO2 and NOx, were associated with risk of MOSLD. Mendelian randomization analysis linked PM2.5, NO2, and NOx-related metabolic signatures to MOSLD. Metabolic signatures mediated the association of PM2.5, PM10, NO2 and NOx with MOSLD. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. Glepaglutide, a long-acting glucagon-like peptide 2 analog, reduces parenteral support in patients with short bowel syndrome, a Phase 3 randomized controlled trial. Background and aims. Glepaglutide is a long-acting glucagon-like peptide, GLP-2 analog developed to improve intestinal absorption in patients with short bowel syndrome, SBS. The authors conducted a trial to establish the efficacy and safety of glepaglutide in reducing parenteral support, PS, needs in patients with SBS with intestinal failure to occlusions. Glepaglutide treatment in patients with SBS with intestinal failure resulted in clinically relevant reductions in PS requirements and was well tolerated. Here are the articles from Clinical Gastroenterology. Pre-injection with ligation-assisted endoscopic mucosal resection for Barrett's dysplasia and early esophageal adenocarcinoma. Characteristic histological features of the depth of resection. Background and aim. Endoscopic mucosal resection, EMR, is an established technique for the diagnosis and treatment of high-grade dysplasia, HGD, and early esophageal adenocarcinoma, EAC, in Barrett's esophagus. Submucosal pre-injection is not universally used or generally recommended when performing routine ligation-assisted EMR. Prior studies, however, have demonstrated evidence of at least superficial muscle injury on ligation-assisted EMR without submucosal injection. There are limited published data supporting any potential benefit of submucosal pre-injection. Our aim was to review this technique and determine the rate of any degree of muscle injury in patients with Barrett's HGD and EAC, treated with submucosal pre-injection before ligation-assisted EMR conclusions. Pre-injection before ligation-assisted EMR achieved complete excision with histologically clear margins, without histological evidence of any inadvertent muscularis propria. Next, we will be discussing articles in the field of infectious diseases. Here are the articles from Clinical Infectious Diseases. Peer-assisted telemedicine for hepatitis C in people who use drugs, a randomized controlled trial. Background. Hepatitis C virus, HCV, elimination requires treating people who use drugs, PWUD, yet less than 10% of POO in the United States access HCV treatment. Access is especially limited in rural communities. ONS conclusions. The peer-tele HCV treatment model substantially increased HCV treatment initiation and viral clearance compared to UC. Replication in other rural and low-resource settings could further World Health Organization HCV elimination goals by expanding and decentralizing treatment access for POO. Next, we will be discussing articles in the field of rheumatology. Osteoclastogenesis in patients with systemic sclerosis with and without calcinosis cutis. Objective. We aimed to assess whether the presence of radiographically confirmed calcinosis of the hands in patients with systemic sclerosis, SSC, is associated with increased osteoclastogenesis. Conclusion. Calcinosis in patients with SSC is associated with an increased propensity of peripheral blood cells to form osteoclasts. Targeted inhibition of osteoclastogenesis may provide a specific therapeutic option for patients with SSC-associated calcinosis. Here are the articles from Arthritis and Rheumatology. Here are the articles from Journal of Clinical Rheumatology. Age-related differences between juvenile and adult autoimmune inflammatory myopathies. Background. Clinical features and prognosis of autoimmune inflammatory myopathies, AIMs, can vary depending on the age of disease onset. The aim of this study was to compare the demographic characteristics, clinical features, laboratory findings, and long-term prognosis of juvenile and adult AIMs conclusions. AIM with different onset ages is associated with distinct clinical manifestations and outcomes. The present study reported that in AIM patients, lung involvement and malignancy increase with age while clinically inactive disease decreases. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. Clinical outcomes with normothermic pulsatile organ perfusion in heart transplantation, a report from the OCS Heart Perfusion Registry. Background. A preservation system, the Organ Care System, OCS, Transmedics, uses normothermic pulsatile perfusion during organ transport for heart transplantation. This system has demonstrated favorable outcomes in hearts recovered from extended criteria donors after brain death, DBD, and donors after circulatory death, DCD. Conclusions. We demonstrate that real-world implementation of the OCS for DBD donors, using predominantly a dedicated recovery team, is associated with expanded donor criteria, longer transport distance, and excellent post-transplantation outcomes. In OCS DCD donors, outcomes parallel those of donors recovered with NRP DCD, and compare favorably with DBD donor organs. Here are the articles from Journals of the American College of Cardiology. New threshold for defining mild aortic stenosis derived from velocity-encoded MRI in 60,000 individuals. Background. Mild aortic stenosis (AS) is associated with adverse outcomes, but is incompletely defined. Conclusions. We report a large-scale study of AV hemodynamics and identify a population threshold between normal and abnormal AV function. Mild AS, as defined by the proposed criteria, was linked to adverse outcomes in the UK Biobank and in NADA. From JAMA Cardiology. Intravascular sympathetic stimulation to facilitate catheter ablation of premature ventricular complexes. Questions. Can stimulation of the sympathetic nervous system from the vertebral veins, VVs, be used to facilitate catheter ablation of premature ventricular complexes, PVCs? Findings. In this case, series of 15 patients with rare intraprocedural PVCs at the time of catheter ablation, stimulation from VVs was safely used to induce PVCs, facilitating activation mapping in 7 patients, and ultimately, successful ablation in 9 patients. Meaning these findings suggest that intravascular stimulation of the sympathetic nervous system via the VVs can be used to safely induce PVCs at the time of catheter ablation. From JAMA Cardiology. Intravascular sympathetic stimulation to facilitate catheter ablation of premature ventricular complexes. Questions. Can stimulation of the sympathetic nervous system from the vertebral veins, VVs, be used to facilitate catheter ablation of premature ventricular complexes, PVCs? Findings. In this case, series of 15 patients with rare intraprocedural PVCs at the time of catheter ablation, stimulation from VVs was safely used to induce PVCs, facilitating activation mapping in 7 patients, and ultimately, successful ablation in 9 patients. Meaning these findings suggest that intravascular stimulation of the sympathetic nervous system via the VVs can be used to safely induce PVCs at the time of catheter ablation. From JAMA Cardiology. Intravascular sympathetic stimulation to facilitate catheter ablation of premature ventricular complexes. Questions. Can stimulation of the sympathetic nervous system from the vertebral veins, VVs, be used to facilitate catheter ablation of premature ventricular complexes, PVCs? Findings. In this case, series of 15 patients with rare intraprocedural PVCs at the time of catheter ablation, stimulation from VVs was safely used to induce PVCs, facilitating activation mapping in 7 patients, and ultimately, successful ablation in 9 patients. Meaning these findings suggest that intravascular stimulation of the sympathetic nervous system via the VVs can be used to safely induce PVCs at the time of catheter ablation. From JAMA Cardiology. Intravascular sympathetic stimulation to facilitate catheter ablation of premature ventricular complexes. Questions. Can stimulation of the sympathetic nervous system from the vertebral veins, VVs, be used to facilitate catheter ablation of premature ventricular complexes, PVCs? Findings. In this case, series of 15 patients with rare intraprocedural PVCs at the time of catheter ablation, stimulation from VVs was safely used to induce PVCs, facilitating activation mapping in 7 patients, and, ultimately, successful ablation in 9 patients. Meaning these findings suggest that intravascular stimulation of the sympathetic nervous system via the VVs can be used to safely induce PVCs at the time of catheter ablation. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. MBX 2109, a once-weekly parathyroid hormone replacement therapy prodrug. Context: hypoparathyroidism denotes parathyroid hormone, PTH, deficiency and impaired mineral metabolism. MBX 2109, a novel prodrug yielding a biologically active PTH peptide agonist, PTH 1-32, extended by a fatty acylated Lys 33, is being developed as a long-acting, once-weekly PTH replacement therapy to conclusion. The sustained-action PTH prodrug MBX 2109 was well tolerated with no unexpected, off-target safety issues. The long half-life and flat exposure profile of MBX 2109's biologically active PTH agonist supports once-weekly administration. MBX 2109 doses were identified for future studies. Here are the articles from Diabetes Care. Diabetes risk after treatment for childhood and young adult cancer. Objective: diabetes is a potential late consequence of childhood and young adult cancer, CYAC, treatment. Causative treatments associated with diabetes have been identified in retrospective cohort studies, but have not been validated in population-based cohorts. Our aim was to define the extent of diabetes risk and explore contributory factors for its development in survivors of CYAC in the UK conclusions. This evaluation of a hospital-based cohort of patients with CYAC identifies these patients' increased long-term risk of developing diabetes, and how this varies temporally according to treatment modalities. Notable contrasts in risk by treatment were detected as early as 10 years after cancer diagnosis. Findings should inform the development of risk-stratified evidence-based screening. Next, we will be discussing articles in the field of neurology. Here are the articles from Neurology. Associations of plasma neurofilament light levels with brain microstructure and macrostructure and cognition in the community-based Rhineland study. Background and objectives. Plasma neurofilament light chain, NFL, level, is a sensitive yet aspecific marker of neurodegeneration. Its neuroanatomical and functional correlates in the general population are not fully elucidated. We thus assessed how brain's macrostructures and microstructures and cognitive function are related to plasma NFL levels in cognitively unimpaired adults over a wide age range. Discussion. Higher plasma NFL levels mainly reflect worse white matter microstructural integrity, especially lower axonal density, in a relatively healthy, community-based sample. This suggests that plasma NFL levels allow for early detection of subtle differences in brain microstructure. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from CHEST. Implementation and effectiveness of guideline recommended clinical activities for children with asthma. Background. Guidelines advise minimizing asthma exacerbation risk, which is achieved partially through good clinical practice activities, including scheduled asthma reviews, inhaler technique checks, and asthma management plans. We assessed how frequently these activities are provided and how effective they are in clinical practice. Interpretation. Our results indicate that most children in the United Kingdom do not receive the guideline-recommended activities to monitor their asthma. This study suggests that these activities, if implemented, are effective in clinical practice and maximally effective when combined in the same visit. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Temporal exploration of chronic obstructive pulmonary disease phenotypes, insights from the COP gene and spiromics cohorts. Rationale: chronic obstructive pulmonary disease, COPD, exhibits considerable progression heterogeneity. We hypothesized that elastic principal graph analysis, EPGA, would identify distinct clinical phenotypes and their longitudinal relationships. Conclusions. This novel analytic methodology provides an approach to defining longitudinal phenotypic trajectories using cross-sectional data. These insights are clinically relevant and could facilitate precision therapy and future trials to modify disease progression. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. Performance of creatinine and cystatin-based equations on estimating measured GFR in people with hematological and solid cancers. Studies on GFR assessment in people with cancer are needed. In this study, the creatinine-cystatin-C equations performed better than other equations, and this was observed in solid and hematological cancers. Our findings give support to the preferential use of creatinine and cystatin-C-based equations in people with cancer. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. Performance of creatinine and cystatin-based equations on estimating measured GFR in people with hematological and solid cancers. Studies on GFR assessment in people with cancer are needed. In this study, the creatinine-cystatin-C equations performed better than other equations, and this was observed in solid and hematological cancers. Our findings give support to the preferential use of creatinine and cystatin-C-based equations in people with cancer. Here are the articles from Kidney International Reports. Systematic review of the effects of iron on cardiovascular, kidney, and safety outcomes in patients with CKD. Introduction. Heart failure and chronic kidney disease, CKD, are closely associated, and iron deficiency is highly prevalent in both conditions. However, major cardiovascular and nephrology guidelines offer contrasting recommendations for iron use. We evaluated the effects of iron versus usual care or placebo on the clinical outcomes in patients with CKD. Conclusion. Iron therapy may reduce the risk of heart failure and cardiovascular death in patients with CKD. Randomized trials evaluating the effects of iron on clinical outcomes are needed, especially in non-dialysis patients with CKD with or without anemia.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.